We're going to demonstrate today this Flexion distraction table that we have in the practice. This is a very handy tool that we have. We use it primarily for disc problems and other degenerative conditions of the lower back. We've talked about discs before. The disc is a soft cartilaginous structure that acts as a cushioning mechanism between the vertebrae. The disc comes under pressure when we start to load it up. So obviously in a horizontal position there's little pressure in the disc. If you come to a standing position we start to load the disc up. If you sit down there's more pressure in the disc. If you bend forward that further increases the pressure in the disc. And the only way you can add more pressure to that really is by adding a twisting component to it. So most commonly we see these discs injuring when people are bending and twisting at the same time. So this table is a device that opens the discs up and takes the pressure out of it, so creating a negative pressure, a little bit like hanging upside down by your feet, and it's a treatment of choice for these disc problems. So Chad, let's demonstrate. We're going to get Chad up on the table. So we want Chad midway on the table there. We're going to tie his feet in so that we can traction him down. And Chad, we want you to hold on up the top here and just shuffle yourself up a little bit. I'm going to increase the stretch a little bit, lowering the table. If the disc is prolapsing to the left, we're going to take the table to the right to open that up further. And the table simply works by opening this area up. So it's a nice gentle action. There's a mechanism at the top that we can use to stop the table in an emergency if we need to. But it gives a nice rhythmic opening to that joint and can be very effective for these disc problems.